Cameron. I'm Sarah.
Hi, Sarah.
Why don't you have a seat for me?
Sure.
Thanks. Thanks for coming to clinic today. Like I said, my name is Sarah. I'm a social worker here at the clinic. And I typically meet with new patients and just check in, see how things are going, and provide assistance if it's needed. Do you have any questions right away or about my role, anything like that?
Well, I just don't know why I got to meet with a social worker and why I have to meet with you.
Sure. So some of the medical providers were actually concerned because you've been missing some of your appointments. So they wanted me to meet with you, check in. I understand that you were recently diagnosed with type 1 diabetes. So we want to make sure that you understand your role in managing this new diagnosis.
Okay.
So can you tell me what you know about diabetes and especially type 1 diabetes?
Well, I know I should check my blood sugars, and it just seems like a lot of work, and I just don't want to do it.
Sure. Well, it's important for you to be checking those blood sugars, and I actually have a brochure here that kind of talks about why it's important for you to be checking those blood sugars. It explains more about type 1 diabetes. Like for example, it's most commonly diagnosed between the age from newborns all the way up to the age of 30. So you're kind of in the middle right now, being at age 17. And it explains in this paragraph here more about what's happening in your body. So your pancreas isn't producing much insulin or even none at all. And your immune system could be attacking these insulin producing cells in the pancreas. So that's why it's important for you to be checking your blood sugars to make sure that there's enough in your body. So diet's important, things like that. And at age 17, we'll typically start talking to people about managing their own health. You're getting to that age now where you might be moving out. I don't know, are you living with someone right now?
Yeah, I live with my dad.
Okay.
His name is Henry.
Okay.
He works 2 jobs, so he usually comes to the appointments with me, but he wasn't able to make this one because he's working.
Okay. So I'm not sure what your dad knows about type 1 diabetes. I don't know if it runs in your family. I didn't see that in your chart. But you're not always going to be living with your dad. You might not be. We're not sure. But at age 17, you're probably getting to that age now where you might be moving out eventually. So we want to make sure that you know how to manage your health, check those blood sugars, and feel comfortable doing that on your own, maybe without your dad's help.
Well, it's tough to check my blood sugars throughout the day because I'm at school and I don't like being diabetic.
Yeah, change is tough. There is another option though, where insulin can actually be continuously infused into your body through a pump. So if you think that might be easier for you, you don't have to give yourself that prick all the time. We could check and see if that would be easier for you.
Well, I'm just tired of not feeling well, so I just don't always go to school.
Well, actually managing your insulin levels is important for your overall health and feeling better. So maybe if that was managed a little bit better, you would feel better, be able to go to school. Because right now I bet school is important for you. Maybe at your next appointment we could talk with your doctor about this other option that I had mentioned. The dietitian would also meet with you. She would be able to explain kind of why diet's important and everything about eating right, checking those levels, and she'd be able to explain more about what's happening when you're eating certain foods. So I guess I could ask, is there any questions you have for me?
Well, when would my next appointment be?
It'd probably be in 2 weeks. I think they want to meet with you. So we could set up a time with a scheduler out front, possibly for 2 weeks. Are there days or times that work best for you?
Well, I'm usually at school Monday through Friday. However, on Wednesdays, usually like after 2 o'clock, I'd be available for an appointment. And
Okay.
usually my appointments are in the mornings, and because of school, I typically just don't go.
Okay, so yeah, you don't go to your appointments because you have school in the morning and not a study hall time, sure. So we can actually go out front and set a time with the schedule, maybe on a Wednesday after 2, just to make sure that you come to clinic, because it is important that you're meeting with us to ensure that we know you're managing your health.
Okay, thanks. That would be good. I would try and see if my dad could make it,
Okay.
you know, because he does work the 2 jobs.
Yeah.
And he has, sometimes he can make some appointments and sometimes not, so.
Okay. Well, if you'd like, I could actually give him a call after our appointment's done, after I walk out with you. I could call your dad and just kind of give him an update about what we talked about, this other option, and let him know when your next appointment is, so he knows and can plan for that.
Okay. Well, we do have a answer machine at home, so you could probably leave a message on there. Or if you call his cell, you could leave a message on his voicemail.
Okay, and I do have that in your chart, so I'll be able to look that up and give him a call.
Okay.
Any other questions?
No, that'd be great.
All right, well, I'll walk out with you. We'll bring the brochure with us, and we'll schedule that next appointment.
Okay, thank you.
Thank you.